right under here in the pelvis and in the vertebra, the density of stem cells are the highest in the entire body. That's why we go to these areas. The PSIS region is just particularly easy, safe, and low risk to get to, and that's why we choose that typically to do a bone marrow aspiration. There's a lot of apprehension in patients when we think about doing a bone marrow stem cell procedure using their own cells. And everyone's really nervous about the bone marrow extraction, and they're told it's so painful and so awful, and they hear all kinds of horror stories. I'm amazed at what I hear. It's actually quite a simple procedure. It takes about 10 to 12 minutes. And I'm going to show you on our little spine model here exactly where we go and what we do, and then you can see it in real time when we actually do it on a patient. So if you look at our spine model here, if the patient's lying flat and this is their back, so there would be a pillow under the belly, this is their pelvis, and their hips would be down here, and then the spine's here. These little two bumps here and here are called the PSIS, or posterior superior iliac spine. They're right under the surface of your skin. If you push on the back of your upper hip region, you can actually feel these ridges in most people. Right under here in the pelvis and in the vertebra, the density of stem cells are the highest in the entire body. That's why we go to these areas. The PSIS region is just particularly easy, safe, and low risk to get to, and that's why we choose that typically to do a bone marrow aspiration. So what we do is patients lying flat, we usually give them some medicine. Sometimes we'll even put people to sleep if they want to with twilight anesthesia. We numb the area over the skin. First we ultrasound to identify this crest. We numb the area over the skin, and then we advance a needle right to that point. And then we typically angle it slightly so that we're in plane with the angle of the pelvis. And then it's a special burrowing needle, so basically I'm putting pressure and gently pushing and twisting. Now that sounds kind of scary, but it's actually quite comfortable. What you're numb might feel a slight ache, but it's not a knife-like pain or anything too intense. And then we gently burrow that into place. And then once the needle is in place under the eggshell, if you will, or the cortex of the bone, into the spongy bone, which is where the stem cells live, then we simply draw blood from that region. So we do a little bit on the right side, and then we come over here and do a little bit on the left side. And then as we draw the blood, the stem cells that reside in the blood vessels or near the blood vessels in the bone marrow cavity are pulled up into the syringe, and then we're able to take them to the lab and concentrate them, and that's a bone marrow concentrate, which is then reimplanted back into the patient into a rotator cuff or a knee or a hip or whatever it is that we're treating. But it's a very simple procedure that has a lot of misconnotations and misunderstanding that it's some awful experience. Having done thousands of these over the years, I can tell you if it's done well, and we counsel the patients to know exactly what to expect. We talk to them during the procedure. It's extremely well tolerated. I always say if you can handle the dentist, you can probably handle this.